If the United States and other Western nations fail to address the AIDS crisis, the virus will continue to spread globally. HIV destroys the immune system of its host. For this reason, it encourages the spread of other diseases. Treating AIDS preemptively defends against other pathogens. Sub-Saharan Africa has some of the poorest countries in the world. Additionally, has the highest HIV infection rates among the general population. Currently, 1 in 20, or about 5% of sub-Saharan Africans are infected with HIV/AIDS. However, foreign medical intervention has been successful in reducing infection rates. Organizations like the United Nations AIDS Program and the Bill and Melinda Gates Foundation show private and public support for combating the AIDS problem. Additionally, advancements in medical technology have drastically reduced the cost of treating AIDS and as well as the effectiveness of treatment. The most obvious impact of HIV and AIDS is a massive amount of unnecessary human suffering. However, there are less obvious results of this epidemic, and it spreads globally.
AIDS has had the largest death toll on the working age population, ages 20 to 49. This means that it strips families of income earners in their most productive years. The AIDS crisis also makes existing problems worse. An example of this is how it contributes to food insecurity when agricultural work is abandoned or neglected due to illness. Overall, the West must view AIDS as more than just another deadly virus. Without aggressive intervention, AIDS will continue to destroy the lives of millions. Unlike most pathogens, AIDS has far-reaching consequences. Beyond the human toll, AIDS threatens regional economics and political stability. It is imperative that Western nations address these threats before the consequences become global in nature. We find 3 compelling areas of reason as to why the West should intervene in HIV/AIDS-ridden countries. First, morally, we believe there is a moral imperative to end human suffering. Second, economic. The negative economic impact of AIDS is threatening regional and global economics. Additionally, cheaper treatments mean less financial stress for Western intervention efforts. And finally, politically, AIDS threatens the political stability of highly impacted countries. Foreign intervention can reduce this stress and allow countries to be more politically productive. For these reasons, we believe that in the interest of global stability, Western nations should intervene in the AIDS epidemic.
The question before us is whether wealthy nations should promote anti-HIV/AIDS efforts in poor nations. The answer is, well, it's complicated. There is obviously an AIDS epidemic in certain African nations such as Botswana and Swaziland, where the adult population rate is 20%, or Swaziland, where the rate is at 26%. When we see these terrible statistics, our first instinct is to naturally ask, what can we do to help? Many Western states and organizations such as the Bill and Melinda Gates Foundation and the Clinton Initiative have perceived the answer as more funding for research and treatment. They often fail to address cultural issues at the local region and fail to recognize the real lack of infrastructure and medical professionals in these global South nations. This was illustrated in 2000 when the Gates Foundation and the Harvard Initiative, in conjunction with several pharmaceutical companies, attempted an HIV treatment program in Botswana. They had an ambitious goal to treat every person infected by HIV. And they also hoped to treat all the late-term AIDS patients with antiviral medication that was currently available. However, this program was never implemented for the very fact that Botswana lacked the necessary medical infrastructure and the trained medical personnel to implement this program. By mainly throwing funding towards HIV/AIDS eradication, the West has irresponsibly promoted and reinforced bad governing practices. The stark reality is that health aid is declining despite new funding. Additionally, these Western foundations have created an intellectual and skill gap in many African nations. They have enabled a diversion of doctors from poor nations to rich nations. This issue must be addressed. If not, it will take several generations for African nations to establish a stable healthcare systems in their individual countries. Have we created a complacency and dependency among African nations on Western nations, particularly the United States? In fact, we have. Take Liberia, for example. In 2013, 73% of Liberia's gross national income was a result of foreign developmental aid. That year, 25,000 Liberians took the college entrance exam for qualifications to enter the University of Liberia. Every single one of those students failed the exam to enter the university. This highlights how foreign aid has failed to penetrate and make an impact on Liberian society. Emphasis on education is lacking both from foreign companies and states and domestic institutions in these African nations. This lack of education is often a result of famine and war, which is primarily caused by Western colonialism. There is a real lack of infrastructure, strong institutions, and educated professionals in many African nations. Is the HIV/AIDS epidemic in sub-Saharan Africa a symptom of a larger issue? We would argue that HIV prevalence rates is part of a larger issue, which is a result of lack of healthcare education and awareness. Although we are primarily focused on foreign nations, the US provides an important lesson. In the late 80s to the 2000s, America aggressively attacked HIV and AIDS by increasing treatment options and awareness. However, with the AIDS scare subsiding in American society, the LGBT community has become complacent as a result. HIV rates are on the rise. Will Africa share the same fate in the future when they become complacent?
In order to support our argument, we would like to include statistics on the AIDS epidemic to highlight how dire the situation is. In sub-Saharan Africa, people with HIV-related diseases occupy over half of all the hospital beds. In a 2006 study on Tanzania, it was estimated that an additional 45,000 teachers were needed to make up for those who had died or left work because of the disease. The adult HIV prevalence ages 15 through 49 is 0.8% worldwide. In sub-Saharan Africa, it is 5%, so it's quite a lot more. And there are 34 million people living with this disease in the world, and 24 million of these are in sub-Saharan Africa. During the widely publicized Ebola outbreak in October of this year, Ebola was killing 13 people per day in the countries of Guinea, Liberia, Nigeria, and Sierra Leone. And during the same period in the same countries, AIDS was killing 685 people every day. In 2001, an India-based pharmaceutical company, Cipla, announced it would sell a generic antiretroviral for $350 per year, which is drastically reduced from its previous pricing, which was probably over $1,000 a year. And the highest infection rate of HIV is in Swaziland. As of 2011, 26% of the people aged 15 through 49 are infected. In 2014, the President's Emergency Plan for AIDS Relief sent $6.7 million in aid to sub-Saharan Africa to fight HIV and AIDS. The Bill and Melinda Gates Foundation has spent over $250 million on AIDS treatment, research, and prevention efforts. In order to support our argument,
These statistics show that there is a need among poor countries and a desire among rich countries, both public and private, to help with this problem. In spite of the need for assistance and the desire to help, AIDS continues to infect millions every year. This does not mean assistance efforts are in vain. Broader and more comprehensive prevention and treatment efforts must be adopted. Rather than focusing on treatment for the infected, efforts must seek to reduce infection rates through preventative measures. A survey of 1,400 Kenyan teenagers found that only 13% of them could correctly identify the importance of a condom in HIV prevention. A 7-year study by the U.S. Agency for International Development found 10 to 15% increased condom use after a comprehensive sexual education program in Nigeria. Although it is not 100% effective, sexual education is considerably less expensive than medical treatment for an infected person over the course of their life. While prevention methods are viable and should be pursued, there is no match for the ultimate prevention method, a vaccine. Discovering a vaccine for AIDS could have the same success, adding HIV to the long list of diseases that are no longer a threat to humanity. This change, however, will only come as a result of Western aid. How much is an HIV-free world worth to you?
To piggyback off of Christian's last statement, in a recent stat from the CDC, Center for Disease Control, in 2011, the estimated number of the new HIV infections among MSM, men having sex with men, was 29,800, a significant 12% increase from the 26,700 new infections among MSM in 2008. And also in 2010, white MSM continued to account for the largest number of the new HIV infections, 11,200. These stats is because the education of this disease and sex ed itself has fallen. Everyone has passed the HIV/AIDS scare, but it has not truly gone away. Perhaps the countries most hit by the AIDS epidemic is Botswana. Western nations have contributed greatly to help Botswana and other African countries. Botswana has been funded by international sources, mostly the US, which have provided $90.3 million to the HIV response in 2011. And the national incident rate, 1.5% or more than 50,000 infections per year. This country has received a great amount of funding. But with this funding, the progress has been very slow. In Botswana, while having this much funding is commended, the low amount spent on HIV prevention programs is concerning. With this much funding, why has the results been so slow? Then we have Swaziland, where its funding is mostly from, again, international sources. Because this country is receiving so much aid from outside sources, which makes Swaziland, very unstable for the HIV/AIDS funding. Why does Swaziland need so much funding and yet barely any progress is made as well? These Western countries are giving aid to these African countries, yet the Western countries, such as the US, just give aid and not to build specific countries in order to build specific centers in order to house the patients and train doctors. For example, the HIV treatment program in Botswana that failed because there was no infrastructure or trained professionals, so the whole program fell flat. By throwing money to help the HIV/AIDS eradication, it has backlash for the Western countries and the African countries. Because this aid is merely going to just research and not much else, doctors are needed. In these countries, health educators and schools need to talk about the epidemic. Without these programs and professionals, the aid can only do so much. It can make a dent, but it will not be good enough. Have we reached a point of no return? It does not seem like it. It does seem like it because of how much the Western African nations need the U.S. specifically as a crutch. These states do not provide education for the citizens themselves. The Liberian example is perfect because what all these billions of dollars done? What has it done? Obviously not educate or help future generations. With all the funds they have been given, barely any nations have kids and have kids and even adults in sex education. Another example is India, one of the poorest countries in the world. Their AIDS rate is 0.31%. For one of the poorest countries in the world, it's amazingly low compared to the rest of the African countries. India's annual income is $689 compared to Swaziland, which is $694. Since Swaziland's income is higher than India's, why can't they have the same results as India? Perhaps the countries most hit by the AIDS epidemic is Botswana. Western nations have contributed greatly to help Botswana and other African countries. But what is the result? Why can't we help? Why can't Botswana help itself as India has done?
And that is a result of a lack of infrastructure and trained medical professionals.
All right, so in response, one of the things that you said was that the efforts have mainly been not productive, that foreign aid in HIV and AIDS hasn't gotten very good results. And I would argue that at least a portion of that is that the aid is focusing on patients that are already infected with HIV and AIDS. Our majority of the aid is focusing on already infected patients, which obviously is not going to be preventing more infections. So the statistics of the people who are getting infected is going to continue to stay relatively the same. And that little work until recently has been done on promoting or discovering a vaccine, which would obviously end the problem for good. And I would also argue along those lines that another debilitating disease, smallpox, for example, was eradicated during the 1970s as a result of a very aggressive vaccination campaign. So I don't know the exact statistics, I don't have them in front of me, but smallpox has also killed millions of people throughout the course of human history. So one of the other things you said too was that it's the results of aid are diverting doctors from poor to rich countries. And this is something that's known as brain drain, and I would argue that that is not a direct response to HIV/AIDS aid programs, that is a bigger economic problem, and that it happens outside of the medical field, and it happens in almost every field, and that it's more a result of economic disparity between two countries, not anything to do with AIDS or HIV.
To respond to your last question, more than 25% of countries in sub-Saharan Africa are actually more poor now than 1960, and we would make the argument that poverty is linked to health. It's directly correlated. And so we believe that if they attack poverty and the structural issues that are at heart, you can get to the problem of AIDS. And also in terms of the vaccine that you mentioned, the first vaccine will most likely be won't be effective as much. There will be a series of vaccines. However, right now we have a drug called PrEP, which is a highly effective drug which helps prevent HIV prevention, and then also helps people that are currently affected by HIV. However, the existence of PrEP have made the LGBT community complacent in America, and as a result, you've seen a 13% rise in the last couple of years in HIV rates. These vaccines we should hope for a vaccine, however, we should not let that be the be-all, end-all, because in the future, that could come back to haunt us. And then also in terms of how effective aid has been, the U.S. alone has given more than $1 trillion in aid to Africa in the last 50 years. There has been admirable gains in HIV prevention and treatment. However, there still is widespread corruption in the allocation of these funds, and oftentimes they put more towards treatment and the manufacturing of the pharmaceutical drugs. However, they don't put enough emphasis on the infrastructure and training medical personnel because of the lack of trained personnel they have in these countries because of the bad poverty situation, which causes these doctors to move to Western nations.
I would say you can't attack the economy like that, like attack the economy first before you get to the health, because you need your workers to be healthy to work and make your economy, or get a boosted economy. So I don't see how like attacking their economy first or improving it, not attacking it, but you know what I mean? And you just need to have the workers be ready to work and have their production come up while they're all healthy, or else what's their incentive to produce so much and trade with us?
Well, I would argue the labor market has been hurt by HIV/AIDS. However, if the poverty has exacerbated the situation, so an easy way to tackle this first would be for something you can solve, which is income inequality. And by targeting this income inequality, it will trickle down and it will help increase awareness and public education, which will decrease infection rates.
The end. Thank you very much.